Hi, my name is Troy Hyland, and I'm your compliance officer, and I'm here today to talk about moral rights in healthcare. We're going to start out with the Code of Ethics, some Code of Ethics stuff, and talk a little bit about the institution's responsibility. They're responsible making sure that ethical standards are being met to keep the patient's best interest in mind. Therefore, they have to have internal controls in place to address any medical or administrative ethical issues, which is part of my responsibility and my job. Um, and as far as research, they also have to have ethical responsibilities um, because these people are also being part of the medical community, even though they're not patients, they are participants. That's why the Institutional Review Board was created to make sure that research protocol is being followed and the participants are treated ethically. And so that part is very important in the research area. The Stark Law. This law was first introduced um, by Representative Fortney Stark, and the goal of this was to really to make sure that physician self referrals were not being done illegally. Making sure that they weren't referring patients to other businesses or health services that they had interest in or family members had interest in, either ownership or otherwise. Um, and it was also intended to protect the patient from excessive or unnecessary testing and treatment. People trying to get more money from the Medicare and Medicaid system by keep referring things and then getting reimbursements from them. That that cost a lot of money to the healthcare industry and has a negative repercussions for everyone. Um, you know, with laws such as the Stark Law, we do have changes in the healthcare industry, such as the introduction of the Affordable Care Act. So it's important that we recognize challenges that are coming along with that. And there is talk of needing to update the language of the law to meet the changing times. So, like currently with the language and the complicated limits that are created, creating roadblocks with the Affordable Care Act. Such as the pay for performance incentives and transitioning into electronic health records in some of the organizations. So it's important that we make sure that the law and the new healthcare act is they're compatible and not stopping us from moving forward. Cultural competency. In healthcare, it's the concept and belief about disease and treatments. They vary from culture to culture. Therefore, we have to develop cultural competence in our environment to make sure that we're providing ethical treatment to all patients based on that. Being aware of their cultures and the differences and reducing the negative consequences, by maybe inappropriately sharing information in a way that might be offensive to them or harm them. We need to always focus on the differences, the way the patient is. However, we also need to focus that on the fact that the healthcare provider also has their own cultural differences as well. So those will intersect. So we have to make sure we are providing training and knowledge for the healthcare providers to understand how it affects the patient as well as themselves. One area of the cultural competence that is interesting in the United States. We seem to be very open with patients as our culture has developed. Sharing bad news at one time was kind of a taboo, but now with the enforcement of the informed consent, it gives more dignity to the patients about making decisions on their own treatment. So we have to be forthright. But in such cultures such as Latin America, they can feel psychological harm can come from telling the truth. So it's really important that we understand that each culture has their differences and how they affect of the way we provide information about their treatments or their illness can be damaging to them. So again, it's very important to have cultural competence within our medical facilities to ensure that we are, being fair to everybody. Well, I hope you got some good information out of this today, and I will update you again next year. I appreciate your time. Thank you.